upper respiratory tract lesions, we are going to discuss common acute infections and common tumors within the upper respiratory tract. But this is going to be in a series of multiple videos. Bismillah ar-Rahman ar-Rahim. Allahumma salli ala Muhammad wa ala Muhammad. Allergic nasal polyp. This is one of the important conditions happening in the upper respiratory tract. This usually happens in the nose. Allergic nasal polyps. It's an important subject. It's important for your daily life and it is important for your exams as well. Nasal polyposis is a benign hyperplastic growth of nasal mucosa. So it is a hyperplastic growth coming from the nasal mucosa. Nasal polyps are generally characterized by edematous masses of inflamed mucosa and abundant inflammatory cells. So the mucosa will become inflamed, edematous, with abundant inflammatory cells, and it will be bulging. The etiology remains unclear. The etiology for these polyposes, for these growths, remains unclear, but they are known to have association with inflammation and allergy. They don't know the exact cause, but their nasal polyp is found with many allergic conditions and many inflammatory conditions. For example, allergy, asthma, infection. Allergy and asthma, those two belongs to the allergic conditions, just to make it easy for you. Allergy and asthma, infection and cystic fibrosis, aspirin sensitivity. So allergy, asthma, aspirin sensitivity, these things are related to allergy, infection and cystic fibrosis. They're all associated. Nasal polyp is associated with them. Nasal polyps are common and they affect 4% of the population. So what are the clinical features of nasal polyps? They can be asymptomatic or they present with nasal obstruction. Patients can be asymptomatic or the patient will present with nasal obstruction, anosmia, difficulty to smell, anosmia or loss of the sense of smell, rhinorrhea, which is runny nose, postnasal drip. Postnasal drip means there are secretions coming out of the nose, but they go backwards to the nasopharynx and downwards to the oropharynx. And less commonly facial pain. Clinical examination reveals single or multiple gray polypoid masses in the nasal cavity. In some patients, we can see bilateral nasal polyps. So, clinical examination reveals single or multiple gray polypoid masses in the nasal cavity. A gray polypoid mass in the nasal cavity. Could be unilateral, could be bilateral. Clinically, they appear as soft exophytic mass that extends laterally from the mucosa into the anterior part of the middle meatus. The anterior part of the middle meatus is here, and these polyps extend to the anterior part of the middle meatus. Microscopically, a nasal polyp is composed of loose mucoid stroma and mucus glands covered by respiratory epithelium, which often shows foci of squamous metaplasia. So loose mucoid stroma and mucus glands, so mucus glands and mucoid stroma covered by respiratory epithelium. Okay? This respiratory epithelium often shows foci of squamous metaplasia. They are infiltrated by lymphocytes and plasma cells. As I said, it is associated with allergy and inflammation, so there must be some inflammatory cells. Okay? Infiltrated by lymphocytes, plasma cells, mast cells, neutrophils, and eosinophils. Now, how to investigate for nasal polyps? CT scan allows evaluation of the extent of the disease, and it is essential if surgical treatment is to be considered. CT scan is important. But when CT scan is important, it's important mainly if surgical treatment is to be considered, because treatment-wise, these polyps could be treated medically or surgically. But if you are thinking about surgical treatment, then CT scan is a must. Okay? And the other thing is, CT scan is important to evaluate the extent of the disease. How to treat nasal polyps? Polyposis, management of polyposis involves a combination of medical therapy and surgery. There is a good evidence for the use of corticosteroids, either systemic or topical, both as primary treatment and as a post-operative prophylaxis against recurrence. It means that nasal polyps are treated either medically or surgically, okay, or both. If you choose to treat surgically, then it's better to give steroids post-operatively to prevent recurrence. So even if you treat the patient surgically, then you need to give him corticosteroids post-operatively to prevent recurrence. For those simple cases that do not require surgery, corticosteroids will also be of help. Surgical treatment has been refined significantly over the past 20 years with the advent of endoscopic sinus surgery, and in general is reserved for cases which are refractory to medical treatment. Recurrence of the polyposis is common with severe disease, recurring in up to 10% of patients. And as I said, even following surgery, there is a role for systemic and topical steroids to prevent recurrence.